Hey, good evening, everyone. Dr. Shepherd here, and I am so glad to be with you on another Friday edition of Ask the Doctors. Come on in the room. I see that some people have already joined us. Go ahead and share. If you are watching us right now live, go ahead and share this post. If you are watching a replay, go ahead and share this replay. I am so happy to be with you again. This is Ask the Doctors, and we're sponsored by my company, Hope Health Systems. And today we have such a wonderful show. We're going to provide some updates, but just wanted to kind of set the room here. Let me know you're out there watching. Today has been such a rainy and windy day out here in the East Coast. It has been a day that actually may set precedents where flooding will occur in certain areas that they haven't seen in over 20 some years. But thankfully, I'm safe, you're safe, hopefully. And as you watch us across the country, I'm thankful for you and for whatever environment where you might find yourself. Some of you may be in a nice sunny place right now, which is awesome. And just glad to have you join us today. Thank you. Thank you, Elaine Winfield, for letting me know that you're out there. She is a consistent watcher. Please let me know that you're out there seeing and viewing us today. As I mentioned, Hope Health Systems is the sponsor of this particular broadcast. It is an outpatient mental health center where I serve as chief medical director. And if you're in need of mental health services, direct care services, I will definitely refer you to them. I co-sign, I endorse happily for those needs. Today, we're going to be dealing with to boost or not to boost, to give or not to give. And we're going to be talking about the COVID-19 vaccine. I know some of you are like, well, what is he referring to? When we're talking about the COVID-19 vaccines. And so I have with me some wonderful experts. These are friends of mine and colleagues, and I'm glad to say that they are both. And I have observed their work. Really, both of them, I've observed them in their actual working environments. And it is awesome to know that there are good people who understand how to be able to break down information so that we can understand and not live in fear, but get the help that we need. And that really is the purpose of why this show was even started. And so today we're going to tackle some tough questions to boost or not to boost, to give or not to give COVID-19 vaccine. So thank you, Sarita Watson. Oh, another consistent follower. Thank you, Toya. All right. Thank you. Well, I know you can't go, just make sure you go back and watch the replay. Thank you. That's my friend out there in California. So I'm glad that we're crossing all time zones. Let me go ahead and introduce our first guest. She's not a guest, she's a friend of the show. That is Dr. Jessica Quinn. So I'm going to bring her in the room and let's welcome her to our platform. How you doing, Dr. Quinn?
Doing well. Good evening, Dr. Shepherd.
So tell the people who you are, what you do, just in case anybody doesn't know who you are.
Okay. So I'm an infectious disease doctor and scientist. I currently work at Johns Hopkins, although I am not representing them this evening. In my work as an infectious disease doctor, I see patients with all sorts of infections, including COVID, and I'm happy to be here.
Wonderful, wonderful. All right, great. And yes, she is not representing Johns Hopkins. All right. I traded I traded Johns Hopkins. I remember I was doing they interviewed me once for a show back when I was a fellow, and I got this call from the media. Oh my lord, you're not supposed to do that. I was like, all I did was just give the people some information. They listen. They say, oh, that's okay. Yeah. So we're just giving information today. We're not giving out treatment. So, all right. Thank you for saying that. And then the next person, our friend and colleague, and she is here. I have to give a nice, slow introduction because she came ready, dressed, and prepared. Uh, the doctor, Nicole Sims. How you doing, Dr. Sims?
Hello. Hi, Jonathan, Dr. Shepherd. I'm doing well. I'm doing well. Thank you so much for having me on the show. I think this is my second time being on, so I
Yeah,
appreciate the invite.
yeah, second or third. I don't know. I kind of like the
Third.
second. Yeah, yeah. I think it's the third time. So tell the people a little bit about yourself.
Dr. Nicole Sims. I'm a board certified internal medicine doctor. I practice as a hospitalist. I work in a hospital and manage patients in the hospital and in the ICU. I'm on the front line seeing COVID patients, and I'm also the medical director of my hospital program. So
Oh, wonderful. All right, wonderful. I don't think I knew that piece. All right, baby.
elevation comes from the Lord.
Oh, wow. Come on here. I love it. I love it. I love it. And so, again, I have two of the smartest doctors, and I just don't say that to be saying that, but ones who I do trust their expertise and their wisdom. And we're going to get into the show at hand because there's some questions that people have. And so, as you are shooting out the questions in the chat or in the comment section, go ahead, share, get somebody who needs to hear this. Share on our social media pages. You can go to my YouTube page also, so you can go and even share on that platform. All right, let's take a deep one dive. COVID-19, we've been into it now for what, about 20 some months, and yeah, it's been quite a task. I'm actually going to start with this question. I've been battling as to how we would start. Give your personal assessment, Dr. Quinn, Jessica. Just give your personal assessment on the progress where we are in fighting this pandemic.
So I think there are some great things and some not so great things that we can reflect on. So, thinking back to the beginning of the pandemic, I think we have a lot more information about COVID as a disease, a better understanding of how it spreads, how we can prevent it, which I think takes away a lot of the fear that many of us were feeling, 18 months ago. As we've talked about before, to me, it's very exciting and kind of miraculous that we quickly got so many effective and safe vaccines out on the market. In the US, we've fully vaccinated over 190 million people, which is about 2/3 of the total population. I think something like 77% of the population over 12. So those who were eligible previous to today's decision about children. So I think in that sense, we've moved quite rapidly toward vaccinating most of the public. I feel very saddened about the vocal minority of the population who is unvaccinated and many of whom are very anti-vaccination. I'm sad about the misinformation that has been spread by many intentionally, which has harmed a lot of vulnerable communities. We've lost almost 750,000 people to COVID.
Right.
Over 100,000 of those have occurred since early this summer, when really everyone was eligible to be vaccinated, as an adult. And so just a lot of people who didn't have to die have died.
Wow.
I'm happy to see that our big summer spike is coming down, but we're still losing over 1,000 people a week to COVID in the country. So for me, it's mixed reviews. I'm happy about the progress we've made. Cautiously optimistic that the numbers are improving, and only time will tell how things go. It's going to depend on, if we're caught unawares by other variants the way we were with Delta.
Dr. Sims, what's your personal assessment?
Yeah, I didn't think that we would be in this for this long. I think that a lot of us felt that once we got the vaccine available, that this would kind of, squelch out things. But we're kind of in a very similar situation that we were in, 18 months ago. And so I echo what Dr. Queen says. We do have some victories. I think that we've come out with a vaccine in record time because there were so many deaths going on. I think that people have become more educated on medicine and vaccines, some to a fault, but I appreciate anyone that wants to be educated and learn. But on the same side of the coin, I think that a lot of expertise has kind of gone out of the window, and people that have expertise are really being ignored. And the amount of misinformation that has been put out there, it's just really surprising and also disheartening, because a lot of people have worked hard to try to come up with a vaccine and to try to educate people, and the misinformation from, like Dr. Queen said, a minority has really gotten the biggest voice. I think now we are in the pandemic of the unvaccinated, and those people that we're seeing are very sick. And it's really unfortunate because a lot of that could have been prevented. But I hope that this broadcast and this information will help some people maybe bust some of the myths. I know that you're a great myth buster, Dr. Shepherd, and hopefully that people can really get some good information and really maybe change some people's minds, or maybe bust some myths that may make an impact. So.
Absolutely, absolutely. So thank you for just setting the tone for our show today. I just want to acknowledge a few people, kind of set the room real quick again. And thank you, Dr. Marie Harris, who's consistent. And I see my friend Clarissa from Chicago. Oh, my Lord. And I see a few of Susan Ott also from Chicago. I'm looking at this question right here from Sarita Watson. I want to read this. I asked a doctor if my son being a teacher and who got his J&J shot months ago. Okay, so she got the Johnson & Johnson shot months ago. Is there a booster for those who received the Johnson & Johnson booster yet? She said he could get a Moderna booster since the J&J isn't that strong. Is that true? So there's multiple questions there. We're going to just go ahead and jump in, and this will help lead the discussion. Who wants to take that on?
I can take that. So there have been a lot of recent developments related to boosters and recommendations from the FDA and the CDC. So the short answer is that for many people, and I'll give you the list, most of the population who has been previously vaccinated, the CDC is recommending boosters regardless of which vaccine you got first. So specifically for J&J, I think most people are aware that although it is very effective, it's not quite as effective as the mRNA vaccines. And part of the reason for suggesting people get boosted is that we now have several months of data looking at how long the protection persists after vaccination. Mm-hmm. We look at a couple of things: how many breakthrough cases are there, and then laboratory tests like measuring the level of antibodies. So for all of the vaccines, the protection is still there after several months, but particularly in people who are immunocompromised, people over 65, and to a lesser extent, people with underlying health conditions, their protection begins to wane. So with J&J, Johnson & Johnson, their level of protection was a little bit lower. So as it starts to drift down, it gets to, that lower level where you start to worry earlier than people who got the other vaccines. So currently, the CDC is suggesting that if you're over 65, if you live in a long-term care facility, and if you're an older adult with an underlying health condition, you should get boosted. Likewise, if you work in an industry where you have high risk for exposure, like healthcare, teachers, grocery workers, other sort of frontline workers. And then there is some middle ground of younger adults, 18 plus, with underlying conditions like obesity, you may get boosted. So it's not quite as strong of a recommendation. When you look at the whole list, which is available on the CDC website, the vast majority of adults, are eligible for boosters. So there was recent data looking at whether you can sort of mix and match, which was the second part of Ms. Watson's question. So you can mix and match really any of the vaccines. For me personally, if I had gotten J&J, I would probably seek out Moderna or Pfizer for the booster. They sort of did every possible combination in this relatively small study, and basically any booster was good. But if it were a personal decision for me, that's probably what I would do. One small difference with J&J. So for Moderna and Pfizer, you should wait at least 6 months after your second dose to get a boost. With J&J, if it's been at least 2 months since your one shot, you can get a boost.
Okay, that's good. That's good. Go ahead, Dr. Sims.
And Dr. Quinn did an excellent job. That was great job answering the question. And there seems to be some thought that because the J&J's adenovirus vector, that adding an mRNA does increase your immune response and your the effectiveness of the vaccine. And so I think she made a really good point that you can get Pfizer or Moderna if you had J&J, and it's actually recommended if you're in those high-risk populations.
Absolutely. So I want you to address the next couple of questions. Thank you, Dr. Hayes. I knew you're going to be joining. He's such a frequent and consistent watcher. So I want you to take on the next question that he asked. He really not a question. He just actually made a statement, and I'm sure that many people out there have felt this. So he had a breakthrough case after being 5 months of being fully vaccinated, and he says he's not opposed to the booster, but the breakthrough situation has kind of put a black cloud over his head with being vaccinated. Speak to that, Dr. Sims.
So we know that there is waxing immunity after some time. And with any vaccine, they're going to need a booster. With most vaccines, Tdap, MMR, polio, they all have boosters for most vaccines because we know that there's waxing immunity. And it's almost like, and I put it like we need to jog the memory a little bit, and in terms of the body remembering, hey, this is something that we need to fight, a booster to help boost your immune system. And so that's really why they even started talking about boosters again, because they were seeing more breakthrough cases. Now we have to remember that the vaccine is not like a silver bullet, right? It's not going to keep you from getting COVID or getting exposed to it. But what it does do, is there like a little echo, or it's okay? Right. What it does do is it helps prevent severe disease and death, and even mild to moderate disease. And so, okay, that's me. And so that is the concern, is that there's going to be more breakthrough cases as our immunity wanes a little bit.
Yeah, absolutely. And so I know that that has been a concern. Our mayor here in Baltimore had a breakthrough case. He was vaccinated with the J&J. And when we say J&J, we don't mean disrespect by it. So thank you, Dr. Quinn. Johnson & Johnson, just a little bit easier to say. And so he was vaccinated. That's Mayor Brandon Scott, who was vaccinated. And he had a breakthrough case just last month, if I'm not mistaken. And actually, I saw him yesterday at an event that the Black Mental Health Alliance held. And he looked to be doing fine. He was doing well, and he was there. And so I understand there could be a black cloud about it. So many times we think that something that we take is going to prevent us from ever having it. Unfortunately, we don't live in that type of world. You're exposed to many viruses on a daily basis. Yet, if your immune system is up to par, it will fight those viruses. So even when Dr. Quinn, and I'm going to shift here, was mentioning immunocompromised, there might have been someone out there who didn't know what that word meant, immunocompromised. That means your immune system, the thing that God has given to you, that you were created with to fight off viruses and bacteria and other things that may try to make you sick. We have those things within us, and we have different types of immune systems, actually, or different methods, I should say, of what makes up our components. I think that's a better word of our that makes up our of our immune system. So, if something is not working right in an immune system, you're going to be more susceptible to a virus. And so, if that is you, whatever reason that may be, then we want to make sure that you are protected. I feel like one of you all want to make a comment after that, and then we're going to shift. I hear you. Come on.
I just did want to say that with the breakthrough cases, people usually have very mild symptoms. We're not seeing breakthrough cases that are hospitalized in the ICU, in the hospital at all. I mean, most times people are fairly, mildly symptom or asymptomatic. And so that even goes to speak to how effective the vaccines are in helping your immune system to recognize the COVID and to fight it. And the immune system is doing what it's supposed to do. So we're not saying that if you get vaccinated, you will never ever be exposed to COVID or get sick, but that you will survive and live to tell the story.
Mm-hmm. I also just want to comment, people may have noticed that there was a bit of back and forth and controversy about whether boosters would be recommended. Mm-hmm. And it's because, the data is limited. And one of the things that people looked at is individuals who got fully vaccinated early, so people who were in the studies, healthcare workers, et cetera, versus people who got vaccinated, 5 or 6 months later, and what were their rates of breakthrough infections. But the other thing you have to realize is that period was when the Delta variant was spreading. So it was probably a combination of some loss of protection, but also a new variant that was a little bit better equipped at escaping our immune response. So the one nice thing about the data we have on the boosters is we looked at how well it boosted your antibody response to the original COVID strain versus the Delta, and it boosted your response to both. So I guess one thing I would say to Dr. Hayes is you may be reaping the benefit of improving your immune response to other variants that may be coming down the pipeline. So a little bit of just like added protection for what may be coming around the corner.
Oh, wow. Wow. Thank you. I haven't heard it put like that. That's good. That's good. Now, the next question is it okay, or will it be okay to take the flu shot and the COVID vaccine at the same time? You want to tackle that, Dr. Sims?
Yes, it's absolutely okay. At first, there was maybe, I don't know if it's misinformation, but people were saying that you had to wait like 4 weeks or 2 weeks before you get your flu or your COVID, and that's not true. You can get them both at the same time, within the same time frame. And I actually recommend that if you get the flu vaccine for sure this year, and that you also get your COVID booster as well. We haven't had a lot of flu in the last year because we were masked and everybody's, inside or whatever. But, the flu is on the horizon. It is flu season for sure. And with COVID too, it's like a double whammy. So we just want to make sure that people are protected as much as possible. We can't afford to overwhelm our healthcare system again, because we don't really have the resources, to be honest.
Absolutely. Did you have anything to add to that, Dr. Quinn? Okay, great. So thank you, Elaine. Hopefully that answered your question, and continue to shoot the questions to us in our comment section. I want to shift a little bit because you were just talking about masks and how we have been isolating many of us over the last several months. But now I'm noticing that there are some counties in the United States. Myself and Dr. Quinn, we live in the state of Maryland, and Montgomery County, which is one of the more lofty, if you would, counties, more affluent there. I think that's probably the best word for that. And they're dropping their mandatory mask mandate for indoors. Mm-hmm. Help me out. What was the criteria to help determine that this mandate would be dropped?
Well, Montgomery County does have a very high vaccination rate, I think above 80%. which is probably partly because it is an affluent county. And also has its own Real Housewives show. And also,
That's right.
also a lot of government employees, live there and commute into DC.
Mm.
They are have a high rate of vaccination. So, I think the things that went into that, we're looking at the rate of vaccination in the county, the rate of spread in the county and surrounding counties. And then, whatever political pressure or public opinion probably played in. I will just point out that in terms of, the state of Maryland and most states in the country right now are classified as having a high rate of transmission, which is over 100 cases for every 100,000 people. Those numbers are coming down from the summer, but are still sort of at like threat level red if you look at a map of the country. So, I guess I would just say, think back to mid-May of this year when the CDC said that vaccinated people could relax with the masks. And then we were all, forced to backpedal 4 to 6 weeks later when cases began to rise again. I personally never stopped wearing my mask indoors, and I don't intend to do it anytime soon. Maybe ask me again in the spring when cold and flu season's over, and we'll see how things are going with cases. But what is the rush? I don't know. At this point, I'm used to wearing a mask. I'll wear it at work for 12 or 16-hour days, and sometimes it's not just a mask. It's, Dr. Sims can attest, a whole lot more protective gear. Hasn't killed me yet. So I would just exercise caution. I don't really care what my city or my county does. I'm not ready to stop wearing the mask in public.
And I think another thing that everyone's like forgetting about or maybe ignoring or whatever, is that our children are still not vaccinated and they're back in school. And so that increases the risk as well. So at least in California, we have definitely counties that are more anti-mask and have really relaxed a lot of mask requirements. And it's so crazy because like I'll walk in somewhere and I'll be in a certain county or somewhere and I'll walk in and I'll be the only person wearing a mask at the grocery store or whatever. And it's just like so crazy to me because I think we had like 8,000 new cases in our county yesterday. And so you have to look at the number of new cases, the number of deaths, and your surrounding counties as well. And we're not anywhere close to releasing mask mandates, but some counties are more lax than others for sure.
And and hopefully the take-home point that you will take from what Dr. Quinn and Sims stated, it's a personal decision, and so don't allow other people, saying that you're good to determine what you're going to do for your own personal safety. You have to be okay with what works best for you and your family. Now, again, I can hear somebody say, well, Dr. Shepard, that's the flip side. And that's the reason why people won't wear a mask because, I'm just going to do me,
But that's what got us here. Everybody just doing them, right? And so, we have to look at the bigger picture and, what's best for the greater good of our communities. So.
Absolutely. Absolutely. Oh, our friend Daryl is here. Yeah. And so he put you out there. You like some candy corn?
I do not like candy corn. Daryl, I'm gonna get you. I think I posted the other day that candy corn is like the chitlins of candy. It's like the worst.
In my professional opinion, candy corn is the worst Halloween candy.
It tastes like depression. It's so sad. So sad.
Oh my Lord. Tastes like depression. Man, okay. In a mental health show talking about tastes like depression. Anyway. Oh, that's hilarious. I just had to get that in there. Wow. So again, you have to do what's best for you. At some point, I did, Dr. Queen, because I actually went out to LA in June. And while I was out there in June, I did stop wearing my mask a little bit while I was indoors. And it felt different. I'll be honest with you, it did. It felt a little bit freeing. But now, and honestly, I kind of went back and forth. I think sometimes I think I left it a couple times or something happened. But I want to let people know that yes, you can still wear your mask and be safe. This is not a question I posed to our guests earlier, but even about coming into larger venues. Um, just speak to that. You see the sports arenas that are now full. Um, Church houses are open. Other places where people gather, they're opening back up, and you see people wearing masks. You see people not wearing masks, depending on if it's indoors, outdoors, whatever. Just speak to that. Speak to your comfort level about that.
I wear a mask in any public arena that I go to, the grocery store, and one for me because I'm high risk, right? I work in a high risk setting,
Right.
and it's important to me to not only protect myself and my family, but also to protect my patients, right? I don't want to take anything from the outside to someone who's already sick and immunocompromised. And I think that, especially as healthcare providers, and I would say this as nurses and doctors, and as healthcare providers, we have a responsibility and a moral obligation to the people that we take care of. I say this all the time. The people in the nursing home that got COVID, it wasn't because they were out and about at the restaurants and it's because someone brought it from the outside into them, and people died, unnecessarily because we weren't protecting the most vulnerable of our population. And so it's especially for our hospital too, like in order to visit, you have to be vaccinated or have a negative COVID test within 72 hours. Just because we still have a high rate of transmission in our county and a low vaccination rate. And so I think, it really depends on where you are. If you're in, Montana somewhere and you have a low rate of COVID, it may be okay for you to, be inside or go to places and not wear a mask. But if you're in someplace like California, if you're in, down south, the Northeast, then you really have to rethink those things.
Dr. Queen, yeah.
Yeah, I mean, I think a lot of it is just weighing the personal risk and your own comfort level. So for me personally, I had started going back to church in person with a mask, but then when the number of cases rose dramatically this summer, I went back to virtual attendance, and I'll probably feel comfortable going back in person, shortly, now that numbers are going down. And that's with the caveat that my church does a really good job of physically distancing people. So that's the added layer of protection. I have gone to social gatherings where I took my mask off indoors when vaccination was required for entrance and it wasn't, an overly large event. Other indoor gatherings, like for instance, my 20-year high school reunion was last weekend, and it was indoor.
How many years? No,
Be nice, Jonathan.
I always get on Dr. Sims, so that's why I had to just show that I'm equal.
Yeah. Equal opportunity, I get it.
Anyway, I opted not to go largely because there was no vaccination or masking requirement. And again, weighing risks and benefits, I wasn't that pressed to go to a high school reunion and risk catching COVID. I also, knowing the demographic of where I went to school, was concerned that the vaccine rate wouldn't be super high. Mm-hmm. I think, so again, to me, it's weighing each individual setting. I do want to caution people that outdoors does not necessarily mean you're totally safe. So if you're in close contact with someone at an outdoor wedding reception or concert, and you're in a crowd and you're eating and laughing and singing, you're exchanging droplets. We have seen reports, of significant local outbreaks at
Wow.
outdoor events where people were unmasked because they felt safe because it was outdoors. So, I think you have to also think about how much close proximity you have to people.
Gotcha.
So,
Gotcha.
yeah.
All right. Yeah, you're helping us. You're helping us. Daryl has a question, and I don't know if we want to just address it. I know we tackled a little bit of it. He says, or he's asking, is the Delta variant still a threat? I haven't heard us address that. We did address has it greatly subsided, and both of you have mentioned how not the transmission, but the number of people who are contracting the virus, how that has continued to subside and has been reduced. Even the number of hospitalizations, number of deaths has reduced. But is the Delta variant still a threat?
I think the Delta variant is still a threat to people that are unvaccinated. And so you can't never say no. I was reading something else about a variant within even Delta, like the Delta Plus variant, that people are looking at as well. So, the challenge is that there will always be some sort of variant, and that is always a possibility. And so that's why boosters and even getting your first vaccination is very important. And like I said before, I don't know if Daryl's on, but this is the pandemic of the unvaccinated. I mean, 90%, 95% of all the cases that we have 100% of the cases we have in the ICU are unvaccinated. But even in the hospital, most cases that we have are people that have not been vaccinated. And the one vaccinated person that we have that has a mild case of COVID, she's in for other things, but she was vaccinated very early on in the COVID pandemic, and probably needs a booster at some point. So,
yeah. You think about Colin Powell, General Colin Powell, who died just within the last week or 2 weeks, and he had multiple myeloma. Didn't realize how many Black people have multiple myeloma. That was education for me. And he had a comorbidity. Comorbidity means he had an illness along with the COVID-19 that made him immunocompromised, which is what I was talking about earlier, how the components of his immune system were not fully optimal because of the different things within his body that was causing illness. And so, I was struck by that. That hit me, a person such of his status and stature, dying from COVID-19. And he was planning to get the booster, I believe, that same week. It was just unfortunate, the timing of his death.
I'm glad you brought that up, because a lot of people are like, see, Colin Powell, he was fully vaccinated and he still died. But then no one really talks about first of all, he was 80 something years old, and he did have multiple myeloma. And so when we talk about, I posted something like this on my page, when we talk about multiple myeloma, it deals with plasma cells, and plasma cells are a big part of immunity. And so yes, the vaccine did probably help him gain some immunity, but maybe he wasn't able to mount a strong enough immune response. And because of that, he did not survive and had complications from COVID. But, a lot of anti-vaxxers just really took that and ran with it. And a lot of misinformation about, Colin Powell and how, see, this is why we shouldn't get vaccinated. I'm glad that you brought that up, because he did have underlying problems. He was immunocompromised. And he, unfortunately, we weren't able to save him through the vaccination. But, that doesn't mean that you shouldn't get vaccinated. That doesn't mean that you shouldn't get a booster. So,
absolutely. Yeah, so I want to even just do a small pivot here. So I want to speak to those healthcare workers who are refusing to get vaccinated. We did talk a little bit about this. I know, Dr. Sims, you mentioned the number of nurses who are not vaccinated. That was troublesome to hear, to be honest with you.
I think that I feel very strongly about this, so I'm going to try not to get, too. I think that, there's so much misinformation about vaccines, and a lot of it is spread too by healthcare professionals, nurses and even doctors that don't fully understand. And so because it's coming from a healthcare professional, people think that it's true. I've been on so many platforms and seen so many pages of people that are spreading false information that are in the healthcare field themselves.
Yes.
And, you know, it's very tricky because I feel like as healthcare professionals, I've said this before, we have a responsibility to tell people the truth. And things that come from us carry more weight than come from someone else. So we have to know what we're talking about. We have to know the sources that we're citing. We have to know where the information is coming from and be good, diligent stewards of the information that we spread. And we also have a right and responsibility to protect the people that we're taking care of. And I firmly believe that. I believe that we all went into medicine to help people and to take care of people. And part of that means that you may sacrifice something for the greater good of your community, for the greater good of people that you take care of. And I'm just going to leave it there. I'm going to leave it at that, Dr. Queen. So I really think that we have a responsibility to take care of those people that are the least vulnerable in our population.
Mm-hmm.
Yeah, I also feel very strongly about this. I mean, first, I do want to say, if you look at rates of vaccination among healthcare workers around the country, 96% of doctors are fully vaccinated. So if you're concerned that, you know, doctors are shilling misinformation, you should realize that the vast majority of us have rolled up our own sleeves to get the vaccine. So I think that should tell you a lot that the people who are have the education to really understand the data have reviewed it and decided, oh, this is what I should do to protect myself. You know, you can go on Fox News or YouTube or wherever and see, again, a vocal minority marching in front of the state capitol in Florida and saying that the vaccines are bad, but that is a small minority. You know, I think there's been a lot of discussion and controversy about healthcare workers who are losing their jobs because they get the vaccine. My employer is mandating COVID vaccination. Mm-hmm. And you know what else they mandate? Every year I'm required to get a flu vaccination.
That's right.
And before I started, I had to you know, make sure that I had all of my full childhood immunizations and check my antibody levels for, you know, measles and rubella and get hepatitis series. And, you know, it's part of, as Dr. Sims was saying, it's part of our responsibility where we take care of at-risk people, that we make sure that we are protecting them from something that we could give them. And also we're protecting ourselves, just like I get extra vaccines when I travel somewhere that has diseases that I might get exposed to. I do it happily because vaccines are great. So I, you know, I understand that people want to make informed decisions about their own health. But the data is good and has been available for many months now. And so I don't have empathy in particular for healthcare workers who have the education and wherewithal to really understand that data, who continue to spread misinformation.
And I think also too that I don't like the narrative that evokes people's emotional response, like, oh, look at her, she's losing her job and she's, you know, been taking care of patients for 20 years. And then everyone's like, well, I don't want that. I don't want to be forced to do that. You know what I mean? And so it's all the whole misinformation and, you know, scheme, I guess, to appeal to people's emotional side. You forget the logical part of why people should get vaccinated, but the emotional side that, oh, they're losing their jobs and, you know, they're not going to be able to take care of their families or provide for their families. And it's just really sad and unfortunate. And I will say also too, it's that, you know, it is still a choice. People, there's this narrative, I'm being forced to do this. Well, no one really has a gun to your head. It's a decision that you have to make if you want to continue employment here, right? There's requirements that you have for employment, and one of those that your employer may be saying is that you have to be vaccinated. It's just there's all kinds of requirements that we do that we don't even think about. But for some reason, when it comes to vaccines, it's like, well, no, this is where I'm taking a stand. If you drive on the freeway, you have to wear a seatbelt. It's a law, it's a requirement. Otherwise, there's consequences for that thing. There's consequences. You could get in an accident, you could get a ticket, you could get hurt, you could hurt someone else. And so the same with vaccinations. If your employer is requiring a vaccination, the consequence may be that you cannot continue to work at this said place.
Mm-hmm. And we have to be aware. And I was talking with some of my colleagues prior to this particular episode of broadcast starting, and I was talking to them about the whole cancel culture that continues to permeate throughout our society. And it really baffles me because you have people who refuse to take a vaccine that could potentially allow them to live longer, but there's no uproar against platforms that destroy our teenage girls. What am I talking about? Even the platform that you may be viewing me on, that's going to be changing its name. That's a problem. That's a problem when I'm unable to teach race or race theory, or be able to teach what happened to Black and brown people in public schools. But yet then you're going to tell me that you can't vaccinate my child, or that I don't have to come to work at that school, and that is my body. It's amazing. So I know some of you are, well, man, that's a stretch there, Dr. Shep. Well, actually, no, it's not a stretch, because we pick and choose things that we like and that we don't like. And unfortunately, when we do that, we end up setting ourselves up for failure. And for Black people, let me tell you, the systems that are out there, Nicole already mentioned, Chief Mythbuster right up in here. The systems that are against you, they are not about to change. And there are people who understand that if we can infiltrate the Black and brown community with myths and lies, that they will believe that. If we can get a prominent person to say, I'm not going to take the vaccination, then they know that people are going to follow them just because he can shoot a basketball so well. And I'm not talking about people. I love sports and professional athletes. What I'm concerned about is our minds, our mindsets, and that we have to make sure that we're looking at this thing on all ends. There's something that I read to Dr. Quinn Sims before we started, and I want to read it right now. I think this is an appropriate place, and then we're going to take it further. But it was a quote from Hart Ramsey, and if you don't know him, you should go check him out. He said, when people want to understand you, they can read a text full of typos and know exactly what you are saying. But when people are intent on misunderstanding you, there is nothing you can say that will make sense to them. Wow.
That'll preach. I try to tell you. I mean, and it's so the truth. People would rather take advice from a celebrity, someone playing basketball, a stay-at-home mom that sells essential oils, than someone who has actually done the work. No shade to single moms that stay at home and sell essential oils. No shade to anybody. But it's the death of expertise. It's the idea that my opinion and what I think is just as good as anyone else's, even though they have the expertise in that field. And as much education as we have, and as much access to the internet and to information that we have, I feel like in a lot of ways it's made people not as smart, because they're not reading the information. They're going to someone's website or someone's YouTube and watching a video where they cut and paste it to say what they wanted to say, instead of really learning the information. A lot of people say, I've done my research and, or I've done my research and I don't think that I should. Well, what research have you done? what, and it's kind of, one of those things where it's like, you really have to, if you're going to make an informed decision, you really have to look at all sides of the coin. You can't just reinforce what you believe looking at other things that reinforce what you believe. You have to really look at the information for what it really is.
Go ahead.
Yeah, so I attended a virtual conference a few weeks ago. It's the annual meeting of infectious disease doctors. It's called ID Week or Infectious Disease Week.
Mm-hmm.
And we spent a lot of time talking about COVID. And I went to a panel discussion about the role of social media in spreading information or misinformation about COVID and vaccines. And one of the speakers talked about how people who often describe themselves as doing their own research, that people tend to go in with a preconceived notion of what their conclusion is, and then they look for sources online that support that conclusion, which I think is, largely what that quote you read was getting at, which is, it's not really an honest attempt to hear other sides or gain information, but rather that you just have this tunnel vision of what you think is true, and you're going to listen to people who support that. And no matter how much evidence you hear to the contrary from qualified experts, it's not going to change your mind.
Right.
So, I found myself arguing in circles with people who have no professional expertise in infections or vaccines, who are convinced that their opinion is just as good as my opinion, even though my opinion is facts based on my decades of training in microbiology and immunology. And sometimes you have to just say, okay, if you decide you want more resources, I'm here.
Absolutely. And it requires us to be open-minded. And I've been saying this lately, that if you're looking to grow, you have to be uncomfortable. You cannot grow. You cannot expand your capacity to think. You cannot be greater unless you grow, and growth requires you to be uncomfortable. What does that mean, uncomfortable? That means you have to think outside how you normally would do something. Think outside the box, as they say, but just think beyond your ability. Well, not ability, but think beyond what you have been taught. Think beyond what you may even believe. Yeah, absolutely. And so we cannot get stuck in ways that really, I'm telling you, it's destroying our people. That's essentially what it is. And let me tell you, there are people behind the scenes. They know what they're doing. And I'm not just making this up. We did a whole show last week. You need to go back and watch if you didn't watch last week. We talked about the media. Is it cure or curse? Oh, man, that was awesome. I mean, I'm still getting some feedback from that show last week, because it just really highlighted how there are misperceptions and how negativity drives fear, and that fear is what makes profits.
That's deep.
People are profiting off of your fear. Think about that. Fear is what drives so many people to do stuff that they normally would not do. And what we want to let you know is, yes, you want to be educated, but don't fear us. This is a time where, yes, it is an unsettling time. Absolutely. But when we talk about fear will cause you to do things that you normally would not do. And this is where you need to be able to hear a calm voice, an educated voice, one who understands what we're going through. And I'm glad to be on a platform right now with voices who are calm, who understand. Yes, they can be passionate, because you need to be passionate about what you do, but yet they are calm and be able to break it down so that we can do better. Wow.
I like the point that you made, Dr. Shepherd, that our Black and our brown people are dying at alarming rates from COVID-19 as compared to our Caucasian brothers and sisters and counterparts. And so, that is something for concern for us as Black professionals, because we want to get the truth out there and dispel the myths and misinformation, because it's affecting us, it's affecting our communities. We've been to more funerals this year than I can even
Yes.
imagine. I've had to call more families that look like me in the middle of the night to tell them that their loved one has not done well or is not doing well and come see them than I want to ever have to remember. And so when we look at, you know, conspiracy theories, think about that conspiracy. I mean, think about that theory is that the misinformation is really coming through our communities and sweeping our communities, and we're dying at alarming rates unnecessarily. And maybe that is the conspiracy itself. Maybe that is part of the plan itself. And so we really have, you know, a responsibility. And I applaud you for having this type of platform for us to speak and to really educate people that look like us or that may not look like us, to really dispel some of these myths and protect our community. So.
Absolutely. Absolutely. Great, great, great. So, with our last couple minutes here, I purposely reserved this. I know that neither one of you are specialized in children or pediatric medicine, but there was a big announcement today. And so, Dr. Quinn, why don't you take us further in that announcement?
Yeah, so today the FDA decided to approve emergency authorization for the Pfizer vaccine in children aged 5 to 11. And the CDC will meet soon to sort of give their formal recommendations. But essentially, you know, we're able now to drop the vaccination age from 12 to 5. It was a nearly unanimous vote based on the strength of the evidence. There was one member of the committee, I believe, who abstained from voting. Everyone else voted in favor. Because essentially, the data that Pfizer presented, I think it was about 5,000 kids who received a lower dose of the Pfizer vaccine. And it was shown to be, I think, 91% effective at preventing symptomatic COVID and was very safe. Kids who had side effects, it was very similar to what it was seen in adolescents or adults, things like fatigue, muscle aches, you know, sore arm, no serious adverse events reported in the trial.
That's good. That's good. Well, that's breaking news, and we are so glad that that is going to come down the pipeline. And really, the pandemic has given us an educational lesson in how our process works. Many of us didn't even understand how medications get on the market. We did not. Y'all just need to admit it. You didn't know. You didn't know what CDC stood for. You didn't know who the director was. You didn't realize it was a part of the government. But this has really elevated our thinking. Honestly, it should have given you an appreciation for what we do here in our country, and it should also give you appreciation that we just don't allow things to happen, especially to our children. Children are not mini adults. MINI. They're not a little adult, so you say it like that. And you have to treat them accordingly. Me being a child adolescent psychiatrist, I treat children differently when I'm going to prescribe medications than I do an adult because they're not the same and they don't respond the same. They don't even look the same when we're going through the same, when we're talking about certain disorders. And so that's why we have to take more time. And, you know, who knows why that person abstained? You know, it's just, honestly, it is a controversial thing when we're talking about children at times giving medication. But when we're talking about this particular pandemic that is, again, destroying our people, we need to make sure everyone is vaccinated. I saw a couple comments. Thank you, Sarita. You mentioned about police officers as public health officials. And I know that even in New York, they were concerned about a third of the firefighters, I believe it was, that they needed to be vaccinated by today, or at least started the series. And if they were not, then they could potentially have to go on unpaid leave. This is serious, you know, and I do plan to continue to break this conversation down and to discuss, I should say, these issues. I'm looking to have a pediatrician. I purposely waited because I wanted to make sure that breaking news occurred. You just never know what's going to happen. And I also want to see what's going to happen once children start getting the vaccine. So look forward to future shows about that. Let's go ahead and wrap it up. Man, this has been good. I just love it. Time just flies. You all have been engaging. Thank you so much. Go ahead and share this particular episode. It will help somebody. I know it will. Those who are watching the replays, thank you again. Like I always say, we get at least a third or times 3 the number of people, I should say, who watch from the live views, and that has continued to grow. And I am so encouraged by those who give feedback throughout the week on the shows. And again, thank you, Dr. Quinn. Thank you, Dr. Sims. Why don't you give some parting words, and where can we find you? Where can we connect with you if you want us to connect with you? If we have some additional questions, why don't we start with you, Dr. Quinn, and then we'll save Dr. Sims for last.
Sure. I guess parting words: if you're not vaccinated, it's not too late. Please get vaccinated. I am, based on the data I've seen, I'm strongly in support of children 5 and up getting vaccinated. I hope that all the children in my family who are in that age group will be able to get their vaccine shortly. I tweet at Jessica R. Queen 1 on Twitter, so please feel free to follow me there. Please do not slide in my DMs asking personal medical advice. Thank you.
All right, set that boundary. I hear you. Come on.
I thought I was going to go somewhere else, Dr. Queen. Let those slide in the DMs. Parting words. I echo everything Dr. Queen said. If you have been vaccinated and you are in an at-risk population, please get your booster. Please get your flu shot. I am on Facebook at Nicole Denise. I'll probably tag myself in the comments somewhere. You can ask me any questions. Again, we are not your doctors. We are doctors, and you have to, consult with your medical doctor, but we'll try to give you as much information as we can to help you make an informed decision. And we're always available for you. You can also find me on IG at Dr. McCutie. And
all right.
Oh, Dr. Shepherd, I love you. But he always gives me a hard time, but I love this show. I do. I love this show. But yeah, we're always available. You can send me a message anytime, and I'll be sure to respond.
Absolutely. Ask the Doctors is on. I appreciate you, Dr. Sims, Dr. Quinn. You have hit it out the ballpark again, and the information that you give is so valuable. I will be getting my booster hopefully next week. I'm going to go ahead and set that up. It has now been actually, I guess I'm more than 6 months out now. I'm about 8 months, so I'm a little bit behind. But because I got the Moderna, Moderna was just approved last week, if I'm not mistaken. So that's why I had to wait. I wanted to go with the same brand, even though I could have done Pfizer. I prefer just to do the same brand. That's, again, my preference. And so I do look. So just in case you're wondering, is Dr. Shepherd going to get the booster? Absolutely, 100. So I am not going to sit that out. And I do encourage you all to get your booster. You can go to any pharmacy or most pharmacies, I should say any, but most pharmacies. Some of them are either doing walk-ins or you can call and schedule your appointment. Some doctor's offices are providing it. I don't see the mass centers like I did when we first rolled out the vaccine. So I don't see those, but you need to go to your local pharmacies, doctors to get that booster. All right. Thank you. Thank you. Thank you, Elaine. Thank you, Sarita. We're going to be vaccinated. Hopefully get our boosters together next week. Thank you so much, Dr. Hayes and Daryl and all those who joined in. I know there's so many people out there watching who did not comment, and I appreciate you for watching. Again, Ask the Doctor, sponsored by Hope Health Systems. We'll do you some good if you want to come on over. We are located in Woodlawn, Maryland. That's the headquarters. But we do service clients and patients throughout the state of Maryland, wherever our license reach. I'll say it like that. So we do have some therapists who are licensed in other states, so that allows them to stretch outside of the state. And you can hit us up on our website, hopehealthsystems.com, and you can fill out an intake form if you're looking for mental health services. People do respond, Dr. Quinn and Dr. Sims, to that request and to that advertisement or advertisement. And so I'm thankful for people reaching out because they feel comfortable. They feel comfortable, and I don't take that for granted that they are doing that. All right, we're going to go ahead and end. Please hang tight, Dr. Quinn, Dr. Sims. We'll see you next week. I'm excited. We're going to deal with some more controversy, and I'm looking forward to some of these guests. And we're going to just, light it up, as they say, and really, hopefully, ask some important questions. And hopefully, you'll leave with answers. Take care. Please be safe.